guys, it's Leona Moat here with Athletic Essentials. Today we're just going over how to relieve the pressure from if you get a black toe. So black toe is called a subungual hematoma, which is basically means a blood blister underneath your toenail. And I got a black toe yesterday at the Utah Spartan race. And so I'm just going to have Kyra just, you can see how it's kind of just discolored. It's my big toe right there. It's a little, there is a little bit of blue fingernail polish on it, but you can see how it's also kind of dark under there. And then right up, as you look under there, let's focus it a little bit. Scoot back a little. There we go. You can see that there's kind of like, it's raised up a little bit away from where it normally is. And so that's a good sign that there is a blister under there. And what you need for this is a needle and toilet paper or tissue or something. So what I actually do is I just poke right down, and you'll be able to feel. You can't hardly feel. It's kind of like a numbing feel when you push the needle in, and you don't really feel it. But you're gonna get your tissue kind of handy because it just kind of leaks out, and so you're just gonna poke down into that blister. See how it comes right out? And then, yeah, you can poke down into it a couple different places along that raised area, because it will just come out. And then as you push down on the toenail, more will come out. It's a little blurry. And then what I usually do is I will go down, and if it still kind of feels like there's pressure over on one side, I'll poke down in there, see what I can get out of that side. Because what I'm kind of doing is I'm just going to push that pressure out. I'm just pushing because it's like a filled blister, and so it's pushing your toenail away from your skin. So you can just kind of do it. It doesn't really hurt to poke it at all. I mean, there's a little bit, it hurts a little to push it out, but it actually is kind of relieves that pressure under there. And it feels actually pretty good. One thing I do like to use, I like to just put a drop of lavender essential oil on there and let it I just drop it like right on my toe, and it kind of just goes around. Now, what will happen, this will save your toenail for a little bit longer. Okay. And it'll kind of keep it attached for a little longer. This whole toenail will eventually pull out. But right now, I just kind of try to keep it on, and once you pop that blister under there and get the fluid out, it might fill back up again, and you can just do the same thing. And then it just makes your toenail look a little bit more normal in the process of you losing it in a couple months or so. So you can come back and... So that is it. It's really pretty easy. You just push that fluid out, and you get the pressure out, and then you're ready to go ahead and run the next day if that's what you want to do. And it doesn't hurt too bad. It's much more painful to run on it when you haven't pushed that fluid out, because it just still, every time you bump it on something, it really hurts. Once you get that fluid pressed out in a day or so, it feels a lot better. So thanks for checking in today, and we'll see you next time.